In 2025, Kenya's promise of universal healthcare stands at a crossroads. As dawn breaks over Nairobi, hope and outrage tangle in the air. The Social Health Authority, SHA, born from reform, now sits at the center of the country's most explosive looting scandal, echoing the ghost of past corruption. August 2025, 40 hospitals across Kenya suddenly suspended.
Social Health Authority has suspended a total of 40 health facilities found to have engaged in these criminal activities.
Patient records frozen. Doctors perplexed. Who are the ghost patients, draining millions in healthcare funds? SHA was designed to fix what NHIF broke. Instead, hospitals filed for procedures never performed for patients who never set foot on Kenyan soil. One such hospital turned out to be a bramble thicket in Homa Bay.
A surprise and a breaking news to me. That is so consternating. How is it working? How is it funded? For what? Where is? When we talk about fund, we don't expect to come and see the cash. We expect to see the hospital working. So this is a waste project.
It has been established that some facilities have been receiving an excess amount of payment. For example, Ladnan Hospital, which was once linked to a senior official in the health ministry, had one of the highest funding. Ladnan Hospital operates under 3 names within SHA, namely Ladnan Hospital, Ladnan Medical Clinic, and Ladnan Hospital Elwak. The Nairobi-based Ladnan Hospital facility in Eastleigh has received a minimum of 195 million Kenya shillings since SHA became operational in October last year. Ladnan Medical Clinic in Wajir received 25,126,820, while Ladnan Hospital Elwak received 2,442,420. The report shows in December alone last year, Ladnan Hospital in Nairobi received 55,592,416, whereas Ladnan Medical Clinic received 6,835,570. A medical clinic, which is a level 3 clinic, should be fetching about 8 to 10 million because of the services it offers.
On its part, the Social Health Authority, in a statement by its CEO, Dr. Mercy Mwangangi, says the hospital in question has been existing since the 1970s and that the journalists who visited the Nyandiwa Health Center were misreporting, saying that Nyandiwa Level 4 Hospital is an operational facility with active claims and what the media visited was an uncommissioned structure. However, the Rural and Urban Private Hospitals Association, that has been demanding payment for services rendered under the defunct NHIF, says this gaffe by SHA is one among many examples of the failures in the new health funding system, and that Nyandiwa Health Center hasn't even been commissioned since the application was made in 2016. A position the Health Cabinet Secretary Aden Duale seems to confirm, while alluding that the payment report on SHA claims to Nyandiwa Health Center was a human error.
Investigators uncovered a web of collusion. Health workers and patients trading codes, digital loopholes exploited, claims for lengthy inpatient care where there had only been checkups. But the trail didn't end at hospital doors. Allegations grew. SHA funds redirected, possibly laundered through Seaton Bank, a financial institution whose quiet change of ownership raised new alarms. Reports in social media private eye accuse a clique with direct ties to State House. For a failed sale, insiders allegedly acquire City and Bank. Soon after, vast SHA and housing levy funds began pouring through its accounts, purportedly controlled by figures close to President William Ruto. Rigathi Gachagua, the former deputy president, claims he was ousted for trying to shine a light on this very scheme, throwing Kenya's political class into open warfare.
And this money for SHA is being taken to a bank that has been bought by the powers that be. Even money for the housing program is being taken to a bank. We'll be giving details. The money for the housing fund, because one, the Ministry of Housing has no capacity to absorb those funds. The PS was saying they have made 2 billion shillings. Why were we deducting people money from the payslip to keep it in the bank? It's very insensitive. We started a levy fund without an infrastructure to absorb the money. The Ministry of Housing, the State Department of House has no capacity to absorb those funds.
In the age of hashtags, Kenya's outrage knows no bounds. Platforms fill with accounts of delayed care and allegations of political betrayal.
Showers from hospitals. People's with hustlers with offices made house. Our parents can't get treated, but someone's building mansions as a show money.
As the scandal unfolds, the Ministry of Health swings the axe. Hospitals shuttered, clinicians blacklisted, hundreds of patients left with nowhere to turn.
The Ministry of Health has intensified the crackdown on health facilities found to have falsified claims to the Social Health Authority. Just 2 weeks after 40 health facilities were suspended following findings of a forensic audit that linked them to claims of falsification, another 45 facilities have been struck off the list of healthcare providers for fraudulent activities. This brings the total number of health facilities that have so far been shut down to 813.
Since I took office on April 1st, 2025, we have intensified the fight. The primary function of our digital system is to detect fraud. We have seen that facilities are looking for innovative ways to cheat the system, but our digital architecture is designed to detect and flag anomalies at every stage of the claim process.
Civil society, MPs, journalists demand clarity. How deep does this rot go? The government initiates audits, biometric controls, and joint task forces. But the public demands more: transparency, justice, and a health system that serves, not siphons.
A crowded billing room at Kisii Level 6 Hospital. Their faces tell a story of mounting frustration. Hundreds of patients, some unwell themselves, others desperate for help on behalf of their loved ones, have been queuing since morning, hoping to access critical healthcare services. But instead of relief, they are met with repeated failure.
The ghosts of healthcare looting run deep in Kenya. For many, it's become personal. A wound not easily healed by press releases or promises. Reform or repeat? As investigators dig, and the country reckons with loss, the world is watching. Will Kenya's dream of universal health survive politics and greed?